Week, the governor announcing that residents 65 and older could get the coronavirus vaccine. That puts them ahead of other priority groups like emergency workers, teachers, child care providers. But will seniors take advantage of that designation? We are joined by Paul Downey. He's president and CEO of Serving Seniors. That's a nonprofit providing meals and support to some 5,000 older adults across the county. And Paul, welcome.
Great to be with you, Jim.
And Paul, I would imagine that you agree with the decision to move the seniors up in terms of their priority.
Oh, yeah, absolutely. And if you look at the death rates that are out there, about 50% of the almost 400,000 people that have died since this pandemic began were 65 plus. So it is a significant portion. And in San Diego County, 1 in 7 older adults over the age of 80 that contracts COVID dies. So this is the group that is most at risk, and it's also most at risk of taking those vital healthcare resources because they end up in ICU and long-term care. So it's the right thing to do from a moral standpoint, also the right thing to do from an economic healthcare standpoint.
So prioritizing them, a very big step, but you would argue that it is far from what needs to be done in order to make sure they get the shots.
Well, the key is making sure that they can get the outreach. Just in the report you just had, the state's rolling out an app. Well, a lot of older adults don't have a smart device, don't have access to Wi-Fi. Maybe they have a flip phone. A lot of them still have an old-fashioned landline. So any system that is out there has to have a phone option where somebody can call in, here's my information, and contact me by phone when when their turn is up. But we can't just rely on everybody has access to apps, everybody has access to a smart device.
Have you been working with state or county officials on what that plan might look like?
Yes, we've been very aggressive about outreaching to both the state and the county, offering our services. I mean, we deliver meals every day. We know where homebound folks are. We're a trusted resource. They look to us for advice, saying we can help find them. We can help get them there. We also have a couple of nurses on our staff, so we've offered. We're waiting to hear if they want to take us up on our offer.
With all the contact that you have with seniors, what's the mood out there? How desperate, if that's the right word, are they to get this vaccine?
Very desperate. We're getting hundreds of calls a day from folks saying when and where and how can I get those vaccines, and we're having to advise patients in terms of, because we don't have the information yet. We don't know exactly how the state and the county intend to do it, but we are urging them to make sure they start making a plan. They start thinking about it, because the county's telling us it's going to be a couple of weeks before folks 65 and plus are going to be able to start receiving the vaccine.
Well, at this point, with the lack of information that you say you don't have, then what kind of plan can they possibly organize?
Well, we're encouraging people to be strategic and assertive about it. So they should contact their doctor. They should contact their pharmacist. They should contact their dentist. They should follow Channel 10 to find out when and where the county is going to have sites. They should reach out to organizations like Serving Seniors and other senior organizations to get the most up-to-date information. And equally important, make sure they have a plan of how they're going to get there, because a lot of folks are homebound. So that means, they have multiple health conditions, perhaps some mental health challenges, and telling them, hey, why don't you take the bus, go down to Petco Park, is not a viable solution. So figuring out how they're going to get there, look to perhaps Lyft or Uber or friends and family. But now's the time. We got a couple of weeks before they're going to be able to get the shots. So work on making an individual plan and have as many irons in the fire as possible, and take whatever one comes up first. Get that vaccine. That's critical, again, because of the death rates that we were talking about and the vulnerability that they have.
Paul Downey is the president and CEO of Serving Seniors. And Paul, thank you so much for your time.
Appreciate being with you. Thanks, Jim.